Who should avoid calcium supplements? Have you ever wondered who should steer clear of calcium supplements, especially when managing hypertension? It is a good question, and understanding the details can help you make informed choices. Let's break it down. First, individuals taking thiazide diuretics should be cautious. Thiazide diuretics are commonly prescribed medications for lowering blood pressure. When combined with high doses of calcium supplements, there is a risk of developing milk alkali syndrome. This condition arises from elevated calcium levels in the blood and can be serious. If you are on these medications, it is wise to consult your healthcare provider about your calcium intake. Next, people with a history of heart disease or those at risk for cardiovascular disease should also be careful. Research suggests that calcium supplements may lead to arterial calcification. This means calcium can build up in the arteries, making them stiffer. Stiff arteries can contribute to higher blood pressure and increase the risk of heart-related issues. If you have heart disease or significant risk factors, discussing calcium supplements with your healthcare provider is essential. Another group to consider is those who already get enough calcium from their diet. If your dietary intake meets your calcium needs, adding supplements may not offer any additional benefits for blood pressure control. In fact, studies indicate that calcium supplementation has only a minor effect on lowering blood pressure. For most healthy adults, it does not significantly reduce the risk of developing hypertension. People at risk of hypercalcemia should also avoid calcium supplements. Hypercalcemia is a condition characterized by high levels of calcium in the blood. Symptoms can include nausea, vomiting, confusion, and kidney issues. If you have conditions that predispose you to hypercalcemia, such as certain cancers or parathyroid disorders, it is crucial to avoid supplements unless your healthcare provider advises otherwise. For those managing hypertension, it is important to note that while calcium supplements may provide a slight reduction in blood pressure, they should not be viewed as a primary treatment option. Instead, it is best to focus on dietary sources of calcium, which are generally safer and less likely to cause complications. Regular monitoring of blood pressure and calcium levels is advisable if you choose to use supplements. In summary, individuals taking thiazide diuretics, those with cardiovascular disease or risk factors, people with adequate dietary calcium, and those prone to hypercalcemia should approach calcium supplements with caution. Always consult a healthcare professional to ensure you are making the best choices for your health.